Good afternoon, everyone, and welcome to this month's edition of Live Discussion Series, where we explore important topics in eye health straight from the experts. My name is Franka Mohammed, and I will moderate our discussion this evening. Today's episode is entitled Common Eye Problems Explained, and we're counting down the top 5 issues we see at our clinics. We have two trusted professionals on our panel this evening, both representatives from Trinidad Eye Hospital, our senior resident ophthalmologist, Dr. Zahrid Mohammed. Most of you may know his friendly face. Welcome, Dr. Mohammed. And Mr. Josiah Ambris, our optometrist. Welcome, gentlemen, and thank you for joining this exciting discussion this afternoon. So to kick off our session, we want to go directly to issue number 5, our top issue. And that issue is eye pain. Many people would experience eye pain. They would be very concerned and worried. What is this eye pain? Should I get to the emergency room? So number 5 on our list is eye pain. And I want to direct this first question to Dr. Mohammed. Can you tell us how would you describe eye pain when you see it presenting in the clinic? What do patients say?
Sure. Thanks again, Franca. Afternoon, everyone. So, eye pain will be any condition that will produce discomfort, aching, usually inside, around, or it can even happen behind the eye. The description patients usually use is a sharp pain, a throbbing pain, or dull ache. Sometimes it could be something simple like dryness or even eye strain, but it could also stem from serious conditions like inflammation. So these would be like a uveitis, a scleritis. You can also have infections, trauma, like any little abrasions, any scratches on the eyes. But more seriously, it could also occur with elevated eye pressure, such as with glaucoma. Usually, eye pain should never be ignored, especially when it's accompanied with vision changes or redness.
I think that's such an important point you make because having a pain is one issue, but if it affects your vision, well, that's another reason to be concerned, because now two things happening in the eyes, and maybe you really should get to a doctor right away. Are you saying that most people should get to the doctor when they feel eye pain?
Yeah, so it usually the first step is you're allowed to try lubricating drops, especially if the pain is very mild and seems related more to dryness, in which case you will have a grittiness or a typically this gravel sensation you might notice and watery eyes. If this doesn't work and the pain is intense, persistent, or you can also have other symptoms like redness and significant vision loss, seek medical attention urgently because you want to be able to rule out any one of the conditions, especially like an inflammation or infection condition.
Right. Okay. Well, I'm hoping that when these patients present with the eye pain, usually able to get it to settle down. I mean, let's say the drops, the lubricating drops don't give that relief they were looking for. Are there other things that can be used to quell this eye pain?
Yeah, so sometimes just resting the eyes is crucial. So having a good night's rest, so that'll help. Warm compresses, cool compresses, eye massages usually work really well when used consistently. So all these things are things you can do at home. Again, once there's no change in vision and there's no significant pain, these things are generally allowed. Having an eye that's quiet but just mildly painful, lubricating drops and little home therapy works really well in these situations.
Okay. Thank you, Dr. Mohammed. Very, very informative. I'm moving right along to number 4 on our list because we're going 5, 4, 3, 2, 1. And number 4 is eye strain. And it's a very common complaint. You hear this complaint from patients, yes, but also from parents looking at their children who are squinting to see their devices, and they may complain of eye strain. Most of these patients probably present to the optometrist in the first instance. So Josiah, I want to bring you in here. What is eye strain?
Hi, so afternoon, Franca and everyone on the panel. So Eye strain is usually that point of fatigue where the eyes meet after using prolonged screen time or even doing prolonged nail work. Patients usually complain of, as Dr. Mohammed may have touched base on, a little bit of mild pain in the eye, in which case you use artificial tears or compressors. Patients may also complain of headaches, which usually present as a tension headache, frontal,
Mhm.
yeah. And they also may have some underlying imbalance in the binocular system.
Oh, that sounds interesting. When you
Mhm.
say an imbalance, like what exactly does that mean?
So usually the binocular system is a teaming system where the both eyes work together. So in one instance, one eye may be doing more work than the other, and
Oh,
that may develop into eye strain.
right, because a strain, it sounds almost like a muscle. I'm
Yeah, is
guessing
that
that
fatigue?
the eye works like a muscle. So if one is overworked, you may get that strain.
Correct.
And strain
And
could develop further into pain, exactly like similar to what Dr. Mohammed was talking about just now.
correct. Yes, in some instances, yes, correct, correct.
Okay, okay. So what would you recommend people could do at home if they start experiencing this strain and having these headaches, these things that
Um,
you talk about?
so usually for self-treatment, you may just want to give your eyes a rest from the task at hand, whether it be watching a screen or whether it be reading for a long period of time. Also, you want to use compressors,
Right.
lubricating eye drops,
Mm-hmm.
as mentioned before. Yeah.
Mm-hmm.
In instances where you find the strain not getting any better, then you will come in to get some a pair of glasses. So we'll try to correct any uncorrected refractive errors you may have, or
Right.
even correct any imbalances you may have between the two eyes in terms
Yes,
of the
because
muscle.
I would imagine one size doesn't fit all, right? Because people may have eye strain, but if these compressors don't work or the 20/20 rule doesn't work, uh, they may have to come in and get a proper
Yeah, that's testing.
examination.
That's correct because not everybody will do the same thing to develop eye strain.
Right. I guess lifestyle, some people
Correct.
uh, have different lifestyles. I would put more strain on the eye sitting at a computer all day, every day for weeks and weeks without taking many breaks would be something that could lead to eye strain.
That's correct. That is
Right.
correct.
Right. Okay. Well, that's very interesting. Let's go to number three on the list. We have teary eyes coming in at number three. Teary eyes. I mean, I never thought that that term is really something that would present as an abnormality in the clinic. Um, is this something that describes tears running from the eyes endlessly, like without explanation? What is a teary eye, Dr. Mohammed? Could you explain what that is?
Sure. So teary eyes or watery eyes is usually a overproduction issue or either
Right.
under drainage. So it could go either from the top or the bottom end. And it's just like you say, some patients will complain that they have this endless stream of tears. Sometimes they get up and they open their eyes and it's just pools of water coming out. And in other instances, you may just get these occasional drops, but it becomes annoying because when you have tears obscuring your vision, you actually start to see blood.
Yeah.
And this constant wiping as well produces irritation along the lids. And it's a very irritable situation in the sense that you always have to be wiping your eyes, never seeing clearly, uncomfortable all the time. So the irritation is real. Patients, you sympathize, and it's not an easy fix. Um, because most time patients going about their way, and then someone points out why you're crying, and does the hardest thing to answer because you're not crying, you just have dry
Yeah.
eyes. Most of the times it is dry eyes, ironically, and you would think that if the eyes are watering, why is it dry? The
Right.
reason is you usually need oil, which is lubrication, not water, and deficiency in that oil layer of the tears is actually what leads to this in most cases. So lubricants work really well if that's the underlying condition. But you also have other situations such as with allergies, and then you have dust like Saharan dust periods. Then you have wind. So sometimes simply the AC breeze from your car or a fan breeze could cause teary eyes. And more rarely you could see like blocked tear ducts. So these would be more like in a younger population, you could get it in congenital issues. In older populations, you get these from little scars and stuff as they age.
Wow, wow, that's a lot of reasons. Like, I'm just thinking it's so ironic that you're saying the eye is watering, and yet the solution in some cases is to add a lubricant. Like,
Yeah,
is it because of the medicinal properties of the lubricant that
e-
it would just assist in a medical way?
exactly. So the way these drops design, they actually help restore tear film, not just the lubricating properties, but the ingredients in them help to bind that lubrication in and avoid the overflowing of these tears. So over time, it's like you're building blocks and you're trying
Okay.
to keep that moisture in. So the recommended interval is about 4 to 6 weeks to see a more permanent effect, but immediately from applying drops, the relief is substantial.
Wow. Very, very interesting. I had no idea that it was so scientific,
Mhm.
and to really think that within 4 to 6 weeks, it's possible to have it fully resolved by simply seeing a doctor and getting treated.
Yeah, true.
Because some people may just carry on thinking, well, this is just how my eyes are, and not really go and check it out because it probably not painful. It's just watering.
Correct, yeah.
Right, right. Okay, well, it's good. It's encouraging to know that there are solutions for situations like this. Um, Josiah, did you want to add anything here? Like, I'm assuming you may see some patients showing up at the optometry clinic with teary eyes as well.
Yes. Yeah, correct. Correct. And usually what I would explain to those patients is like it's just like a reflex property. The same way your eyes will tear up if it's gonna push your finger in your eye. It's the same thing that the eye will do when it's dry. It will always try to compensate for the dryness by always tearing up. And as
Yeah.
Dr. Mohammed said, the drops is used to keep in the moisture. The tears from the reflection is not sufficient enough to lubricate the eye. So usually that's where the medicinal property of the drops come in and everything.
Okay, well, it's a bit comforting to know that, it's nothing too invasive to solve that problem. So thank you for that information. So we're getting closer to number one. We're reaching to number two now, and I'm hoping that viewers are getting the questions together because we are going to have a question answer segment, and keep sending those questions because I know we may be answering some things, but some things you might have that you're not hearing and you want to get a response on. So we'll try to address those as well. So for the number two issue, we have red and itchy eyes. So this is another common problem. I mean, everybody who's gone to school has heard of red eye and been very afraid of getting it because it's so highly contagious. Like, is every red eye the same? Like, or itchy eyes? Do they always present the same way? Is it red and itchy, or could it be red only, itchy only? Like, what is this about? And I'm assuming somebody would present to the optometrist first when they have this problem. So, Josiah, do you want to tell me what is your experience with red and itchy eyes in your clinics?
Yeah, so the red eyes is usually when the blood vessels in front of the eyes are dilated, so they engross, so that brings about the redness. That could be due to irritation or even something like inflammation of the eyes. It could also be due to something simple as just a small touch to the eye or a minor or a major injury. Yeah.
Okay.
Usually the cause will be the driving factor, what cause the redness or have the eye so red at a certain degree. If it presents with other things like itching, then we look for other causes like allergic causes. Um, if it presents with different discharge, we look for bacterial causes or viral causes. Yeah.
And I'm
Um,
guessing contact lens users might
Well,
have
yeah, I
this
was now
too.
coming to that there. So
Mm-hmm.
usually patients when they present with glasses, but with contact lenses, is the overuse of the contact lens over a specific wear time. So each contact lens carries a certain hydration, and after a particular time, the water content will slowly leave or the lens will dehydrate, and that will be the wear time of the lens. So patients usually do not adhere to their eye care provider and overwear the lenses or even sometimes sleep in the lenses, and that will cause irritation, and that will lead to also redness induced by the contact lens.
Understood.
Yeah,
Understood.
cases
So
like
how would
these,
you treat
tell me.
so treating that issue, specific to what you just said about the contact lens irritation and so on, what is the normal, well, what is the remedy in most cases from what you've seen in your clinic?
So for self-treatment, usually, if it doesn't present with any other signs or factors, it could be self-limiting. So we let the patient just rest or
Okay.
just use some lubricating drops. In the
Okay.
instance of contact lenses, you stop contact lens use. So you take the lenses out and you give it a little rest for a week or so.
Yeah.
Observe the eyes, see if they're getting any better. In
Mm-hmm.
the chronic terms of things, if the redness is not getting better, you come to us, and depending on what we see, we will then further you towards the consultant, which is Dr. Mohammed, and then he will do the rest in terms of management.
Because I could imagine if contact lens wearers know that there's a simple remedy, they will abuse the length of time. Like, they might say, oh, well, I just need to put drops after. Why should they not do that? Over the long term, constantly over wearing your contact lenses, leading to red and itchy eyes. What could be a longer term consequence for doing something like that?
Yeah, so usually you will want to take out the contacts and hydrate them if they are not daily disposables, clean them properly. And then usually what tends to happen is if you don't tend to do that, the lenses will dry out on the eye. When that happens, it tends to stick to the front of the eye, leading to
Right,
more irritation, congestion of the eyes, and so forth. And then
right.
also due to the lack of hydration on the lens, it tends to accumulate different deposits, which could then lead to further inflammation of the eyes. So it's
And we don't
always
want
good
that.
to hydrate and take the lenses off the eye,
Yeah.
especially as advised by a provider, a contact lens
Yes.
provider.
Yes, I think that's very important. A
Yeah.
very important takeaway. Do not overuse the contact lens. Use as prescribed by the practitioner. So, Dr. Mohammed, just to bring in from the medical aspect, because Josiah was talking about the optometry side of things. When it comes to your medical clinic, red and itchy eyes, do you see a most common reason for the red and itchy eyes? Or is it similar to what Josiah was saying?
Right. So the most common reason we'll see is usually from dry eyes, and it would stem from what Josiah was saying, especially with contact lens, whereas they have very dry eyes generally. And the advocation with the drops is key for those. But then you have dry eyes that generally happens, especially as they get older with prolonged screen use. Drivers get it because of not blinking. People who read a lot generally have dry eyes as well, and it'd be from any activity that you're focusing and putting a lot of effort into. Generally, there's a reduction in your blink reflex.
Right.
Blinking is what pumps these glands to get the lubrication going, but if there's reduction in blinking, there's reduction in lubrication. So dry eyes is actually pretty common, and I would class that as probably the most common condition we'll see, accounting for red and itchy eyes.
Right.
Second, you could probably say like conjunctivitis. So those would be any allergy, bacterial or viral causes, but generally the allergic ones, I would say as second mostly, yeah.
Okay, well, good to know that, it may not be anything too serious, but
Mhm.
still, people shouldn't self-diagnose, right? They should
Exactly.
still
Yeah.
turn
So
up and get a proper professional assessment.
exactly, because sometimes there's no way, like even the allergic, the viral, bacterial, there's no way to determine which one unless you really have a good look at the person's eyes. For example, if there's just itchiness and a bit of redness
Yeah.
and be diagnosed as an allergic type, drops work really well, especially the antihistamine ones, and they clear up really fast as well. But if there's an
Okay.
underlying bacteria or virus is the cause, then these are a lot more serious and they need urgent care. Antibiotics, especially like drops and tablets, sometimes lubricants, and the whole host of
Yeah.
regime might be needed. So there's really and truly, you should have your eyes checked if you find this redness is not going away. You're noticing swelling along the lids as well. So that's another key finding. So it's not just to discredit it as dry eye, but monitor anything usually very closely and any worrisome sign, you should have it checked.
Okay. Great information, great advice. And that brings us to number one, which I think most people might be waiting to hear. Blurry vision. Number one on our list is blurry vision. It's probably one of the most common eye problems that we also see at our clinics. So, Dr. Mohammed, as you are talking on this topic, what is the most common, what is your definition of blurry vision? Let's start with that.
Sure. So blurry vision is when your sight becomes fuzzy, cloudy, or unfocused, and this could occur either at a far distance, it could occur near, such as with reading, or it could be both. Another key feature is it could happen gradually or suddenly, so there's no distinction between the two. Um, Sometimes it could simply mean just needing glasses, in which case, Mr. Ambris, Josiah, he could expand on that and he could solve the issues. But sometimes there's more serious conditions like patients who are diabetic, they may have diabetic swelling, they may have bleeding, you could also have cataracts, and you could also have a retinal detachment, which is a more serious medical emergency type.
Wow. So I feel like out of everything we talk about so far, this one might be the most what to say, like the one that's most serious. Like if that's something I could say. What do you think?
Yeah, I would agree 100, yeah, because blurry vision is anything that affects your vision, affects your quality of life. So that's key. Yeah.
Okay, so definitely patients have to make it a priority to get that appointment once you experience blurry vision, even if it is for one afternoon and then the next day everything's back to normal. Because sometimes you might have this problem where you have blurry vision, but next day you wake up and it seems to clear up. That's okay. Like I could just move on with life, or should you still check the doctor in that case?
And if the vision returns to normal and there's no change at centrally or in the peripheral vision, usually you can monitor it unless you have serious medical conditions like heart problems,
Right.
you've had a lot of strokes or lots of heart attacks in the past, um, you have uncontrolled blood sugars or blood pressures. These would be key into finding if this is a one-off event or if this is something that might happen repetitively. In which
Correct.
case, if it does occur in succession, you should have it checked out because it could be a serious vascular problem. If it's just a one-off once every few weeks, every few months, and it's not
Yeah.
really affecting your vision, and you're doing your checks on your own, closing one eye, checking the other one, your distance vision and your vision is okay. And if like Josiah had mentioned, you've been diligent with lubricating drops, you were able to get those and try them, and the vision actually seems much clearer, much brighter, much more stable. You can monitor on your own, but if this is not the case, you really should have it checked out and make sure you're not at risk for any serious problems further on.
Line. Okay, thank you. That's really great advice. So that was our number one. And Josiah, I have to let you weigh in on number one, blurry vision. How does that present in the optometrist from the optometrist perspective?
Yeah, so usually patients present with blurry vision will be due to uncorrected refractive errors, whether they being far-sighted, nearsighted, or even having astigmatism. What we'll do is use biconvex or concave lenses, biconcave lenses, convex lenses to kind of correct the light pathway so it fall on the retina to kind of bring the vision into clarity. In some instances, we may not get the vision very clear, and patients could fall into a category of low vision. In an instance like that, we will use more stronger lenses such as spectacle magnifiers or different aids to just help magnify the vision a little better to help see through that blurriness or just to bring a little bit of clarity.
Okay.
And well, as Dr. Mohammed says, it's all about quality of life and functionality. So once the glasses brings about that or assisting that, then our job is halfway done.
Right. So I'm guessing if patients don't have underlying serious medical health conditions or past history of strokes or heart attacks or high blood pressure, like what Dr. Mohammed was saying, the first step is with just a completely healthy person, vision drop, blurry vision, you would say their first point of call could be the optometrist to check to see if they need glasses.
Most definitely. Usually it'll be patients in the working class that will be presenting with blurry vision a lot because of that lack of accommodation or that loss of accommodation with age which is called presbyopia. So they
Right,
usually need that extra assist
right,
from the lenses.
right. Okay, so and it is possible that if you pick up something more serious during the examination, you could refer to the doctor as well.
Yeah, so usually during the exam, patients might present not even knowing they have blurry vision because they're using the dominant eye to do everything around them.
Right,
So it's
right.
only after we cover that better eye and they say, whoa, something is wrong here. We definitely know there's a problem. We do further testing and then we send them to the consultant.
Wow, wow, very informative. So
Yeah.
so glad that you all explained this. I don't want to end this discussion without taking some questions from our viewers. It was such an informative question answer here. But I want to ask the first question that came in, and I think this one is for Dr. Mohammed. We have one question asking, what treatment is there if you are feeling pressure in the eye? So I don't know if pressure means like a throbbing or if it's similar to the eye pain we talked about or the eye strain, or is it completely different entirely when you talk about eye pressure?
Right. So eye pressure could be accompanied by vision changes, or it could be without. Vision
Right.
changes with eye pressure is usually serious, so you'll have to be screened for things like glaucoma, any infections, inflammation. If
Mhm.
there's no visual changes and it's just this eye pressure, usually that's one of the terms patients will use to describe a dry eye. So they get this pressure sensation, this
Mhm.
heaviness, this tired looking eyes, and usually lubrication drops could help in the first instance. But um, as Josiah was iterating, and as we spoke on along the last 5 points, um, once you use dry eye drops, you should monitor closely. You want to be able to notice for an improvement. If let's say after a couple of days there's no improvement, you really should be checked because things like glaucoma, which is a high eye pressure condition, is really hard to determine eye pressure. So it's symptomless basically, and you can only know the eye pressure when you check. So that'll be on using the instruments we have, such as with the clinic, or with screening. And that's the only way really most patients have a eye pathology or impending glaucoma. So there's a big distinction between the two, but monitoring again is key. So start with drops first. If there's no improvement, then you really should have your eye pressures checked, at least just to make sure.
Mhm. Okay, that's good advice. So you can never really decide it for yourself, basically.
Yeah, it is really hard to tell, and that's what makes glaucoma so serious. Because most patients have it and they wouldn't know. But it's not to say that eye pressure alone is everyone with eye pressure has glaucoma. It's hard to make the distinction with all the eye pressure. But yes, you can use eye drops initially, and there will be an improvement with lubricated drops if there's no glaucoma. But if there's not, then we really have to screen and make sure. Yeah.
Of course, of course. Well, thank you for that explanation. We have another question, very specific, asking what causes floaters in the eyes?
Sure. So, floaters could arise from a host of conditions or underlying issues. So, diabetic, sometimes high blood pressure patients. So, floaters is like a broad category. It's like an umbrella term then. So, anything that's in your vision but is not really there. So, patients will say like they're seeing flies or ants. They think it's there, but when they move their hand, it's not there. It's just in their vision. So that's what a floater generally is. Diabetics and hypertensives, they are at higher risk for hemorrhages, which is actually blood in the eye. and that'll be term floater once it's in the vision. Then you could have inflammatory components such as with the uveitis we had discussed, and then there's just PVD, which is a vitreous detachment, and that's an age change. The
Right.
previous ones we highlighted were more harmful. There are signs of problems and vision issues and pain. But PVDs, which is more the harmless type, those are more age-related changes. The the best way to distinguish between the two is having a dilated exam, because your doctor or your optician will want to visualize that blood. They'll look out for signs of infection, inflammation, like a red eye, a painful eye. They'll want to at least visualize the floater and determine you're not having any additional symptoms like flashing lights. If you're short-sighted and you're having flashing lights and floaters, and you're at a higher risk for things like retinal detachments, which is a really vision-threatening condition, and if not caught early, will need surgery generally to fix. So, floaters again are umbrella term, be caused by different things, but it's usually because of an underlying condition. But most importantly, it could also be harmless, and the only way is to actually dilate and make sure.
Yes, very, very good reminder. We have to check it. Even, I mean, some people are scared, eh? They don't want to hear that something is wrong, so
Exactly.
they might
Yeah.
just defer and say, oh, I'll check that next week, I'll check it next
Mhm.
week. And then they never check it, and then it gets really serious. So,
Exactly.
so the
Yeah.
thing is, we are urging patients who experience these symptoms to have it checked. You might put your mind at ease much sooner than you think.
Yeah, of course. And there is a possibility this floater could actually be nothing. And if it's nothing, they'll fade in time. But
Right.
it could be something, and you could actually be delaying a serious condition from being treated and restoring vision, especially if they are big floaters,
Of
which
course.
this would be like hemorrhages and stuff. Yeah.
Of course. So even though these problems sound, kind of scary sometimes, the truth is there are treatment options. There is a lot of support available, and patients can get the help that they need. So I'm really grateful that you guys shared all your knowledge. I want to thank you both, Dr. Mohammed and Mr. Josiah Ambris, for breaking these issues down so clearly. You made it simple, easy to understand. These eye symptoms could be scary, but getting the right care early on can make all of the difference. And I really think you all gave us great reminders of that today. So I want to thank you for joining this panel and for sharing your knowledge. Thank you to everyone who tuned in, who sent your questions. If you're experiencing any of these eye issues, do not be afraid. Go see optometrist, see your eye doctor, book an eye exam. Let professionals help you keep your vision healthy. We are in May, and May is Healthy Vision Month. So this is the reason we chose this topic. We want you to feel comfortable to go and have your eyes checked, have your eyes screened, and you could be healthy as you could be, and have a great quality of life for as long as possible. So thank you for tuning in. And good night, everyone. Until next time, we will join you in June with Cataract Awareness Month. We have exciting speakers lined up. So thank you very much for joining in.